Hey everyone, it's Dr. Namani and Dr. Louie here back today with the Athlete Spine, and we're really excited to have on Dr. Jennifer Kelly here, who is a rehab and pain psychologist at Virginia Mason Franciscan Health, and someone that we know and hold near and dear to our hearts. So thanks so much for coming on with us.
Thank you. I'm so excited to be here.
Yeah, and our topic today is really interesting. And you've seen our previous video where we were talking about doing this two-part series on, hey, there's so much involved in getting athletes back to their sport, getting back to activity, really getting any patient back to any activity they want to do. And we've really focused on the spine surgery side, or the spine problem, right? The anatomy, the pathology, the surgeries, the different treatments. And as you saw in the previous video, we talked about, well, there's other members of this team that needs to provide care. And, you know, one of the most important aspects that we consider in our practice, and a lot of the athletes that we work with or even talk with, is there's a large mental and psychological component to recovering from any type of injury or surgery that we've performed. So, Dr. Kelly, it's really awesome to talk to you today. Tell us a little bit about what you do and sort of what you enjoy most about your work and what exactly it is.
Yeah, so as a rehab psychologist, I work with patients who are dealing with a wide variety of chronic illnesses, injuries, chronic pain, or intermittent pain, even acute pain if they've just recently been injured. And what I do is I take a biopsychosocial approach, which I'm sure is a term many are familiar with, but it's really looking at not just the physical ailment, but the person's reaction to them, how they're coping emotionally, the thoughts that go through their mind, what that means for their ability to engage in activities and function, and how they function socially, which is a really important piece that I think is often missed. You know, if they don't have good support around them, they may be less apt to follow, you know, the instructions for rehab post-surgery, for example. And so assessing all of those variables is really important. And then the biggest part of what I do is really just providing interventions and education for patients to learn techniques for reducing the stress response to their pain or their injury, which helps promote healing and reduce inflammation down the line. So it has a lot of physiological consequences. But the biggest thing that I really want to impart to a patient is strategies that help them build their confidence, you know, so that they can feel like, even though I may be dealing with ongoing residual pain, I can manage it because I have some tools in my toolbox for doing that.
Yeah, you know, given that 80% or more of the population experiences back pain at any one point in their lives, you know, anyone can attest to the fact that, you know, even if you have a couple of days of pain, it can be a really big damper on your mood and your desire to do much of anything, you know. And so then you extrapolate that out to, you know, people who have had chronic pain for, you know, years or decades even, you know, and how that can affect your psyche, your desire to do things. And you can see the immediate benefit of someone like you know, who can really help patients try to overcome and be able to persist and get on with their lives, you know, and develop strategies to deal with those things.
Absolutely. I certainly try.
Yeah. And I think that the athlete population is really unique too, right? A lot of times, right, if let's say people who aren't in that type of physical field have pain, they can rest and they can, you know, there's ways to sort of work around that. From an athlete, for the professional athlete especially, that's sort of their job. That's what they do.
Yeah.
And for a lot of other people, that's an outlet and what they enjoy doing most. And so learning to deal with that pain and overcome that pain is so important in that population. And then what barriers and obstacles have you seen they face?
This is huge because, yeah, it's not just, you know, the activity they engage in or the thing they enjoy. It's part of their identity in a lot of cases. And if you think about an injury causing you to be sidelined from this activity that you do that gives you identity, helps you set and achieve goals, and gives you social connection, and being away from that is huge. There was a study done not too long ago that interviewed athletes, post-injury. And one of the things that they say that they wish that their doctor had asked them about was how they're just coping emotionally. How are you feeling about this injury and having to step away from your sport for this long? And I think that's just a piece that's often missed, but it's huge because you got to think about the overall context too that the athlete is operating in. When they're thinking about return to play, they might be getting pressure from their coach or their teammates to return back to the same level that they were at when they left. And it's important to acknowledge that, they may not understand that they need to gradually, progressively return to those activities. So they may be more apt to kind of push themselves too hard, or the opposite of that, where they might feel afraid of re-injury and maybe holding themselves back more. And so these psychological pieces are so important to address, not only for the medical provider to ask about them, but for the athlete to really consider, like, this is something I want to explore and talk about. And maybe that's with my teammates or my coach or my friends, or maybe that's with a psychologist like myself, but just to be able to explore that and not discount the importance of those pieces.
Yeah, I think a lot of it is the fear of the unknown, right? So if you're an athlete who has an injury, I think that anyone who's gone through an injury, and especially a professional athlete, has this fear in their mind: am I actually going to be able to return to my job or to my sport? And even if it's something innocuous, but I think that fear is there, and that can affect their ability to engage in the necessary rehab and recovery, and it can kind of become this vicious cycle, and harnessing the power of the mind to kind of break that and to engage and to recover in an appropriate manner, I think is really critical.
It's huge. One of the things I teach in my group classes is the importance of identifying when you're in a state of fight or flight, or fight, flight, freeze, fawn, if I'm going to say all of them, that alarm system response. When you're feeling frustrated, when you're feeling fearful, and you're in that heightened stress state, you're more likely to be distracted. You're less likely to think through, make wise decisions, stick to your plan. You're actually more likely to get injured too, because you're not necessarily using proper body mechanics and paying attention. So building confidence and having a way of turning off that alarm system and calming the nervous system down so that you can make wise decisions is so crucial. So that confidence piece is big. And there's an inventory actually to use for with athletes who are returning to play, which assesses their confidence. How confident are you in your body's ability to engage in the sport again? How confident are you in your ability to manage pain that might come up? And if they score below the cutoff, and from a psychological perspective, they're probably not ready to return to play. Even if their physical injuries are all healed, they may still not be ready because they're struggling with fears or frustrations. And so I think it's important to assess that and just be aware that that can be a huge barrier to returning to those activities again.
You mentioned kind of in passing that you do some of these classes in groups, and have you found that having other multiple people in the same session helps with engagement and alleviating some of those fears, or do you feel like that certain people or patients or athletes would do better in an individual setting, and how do you kind of determine that?
Yeah, it's a great question. I would say the short answer is yes. I think the group aspect of those classes is the secret sauce, because that social support piece is so important. Pain, injuries, going through a complex spine surgery, these things can be very isolating because usually the immediate friends and family are not dealing with those exact issues. And the person becomes in the role of the patient. That becomes their identity, at least for a short period of time, and they feel alone. And the group classes allow them to see that there's 10, 12, 15 other people sitting right there in that session dealing with something similar. They all have different injuries, different surgical procedures happening, different types of pain, but just knowing that there's other people out there dealing with that too, I think provides that validation and support. And a lot of times a patient will share over the course of the classes, I found this app that really worked for me, or I used this particular type of heating pad that really helped. And I had no idea that that even existed. And they share that. And then someone else in the class says, cool, I'll try that. And it works for them. And so I think that group component is so important to refer patients to if it exists in your organization, because it really can be helpful. When patients are working one-on-one, often they will get self-focused and internally focused, and they'll start kind of harping on all the things that they've lost, all the impairments to their functioning. When they're around others, they tend to want to build themselves and others up. So they tend to focus on what works.
Yeah, that's a really cool concept. And I think that people, it's not that misery loves company. Maybe it sort of is to a certain extent, but I think that a support system is so important, and just knowing that there's other people that are on this journey with you, it just feels so much less isolating. I think one of the last questions I have for today is that, so we have a lot of athletes that sort of tune in or watch or follow us, and a lot of people who like think they're athletes sort of like us, but we all sort of go through a lot of episodes of pain, or we've all had to recover from something. Could you give us one or two like very broad coping strategies that people like us or other people trying to overcome pain to get back to some sort of activity could sort of embrace and try?
Oh, yes. Oh, there's so many that I can think of. I have a toolkit that I share with patients, and it's 2 pages long. So there's a lot of different categories. I think the first one that I would say is the cognitive behavioral therapy skills. So I always ask patients in my first class when they go through the series, what are the thoughts that come to mind when you think about pain? What is the story that you're telling yourself about this experience? Because the reality is our experiences are a story we tell ourselves. What is the meaning that you assign to the pain? What does it represent in your life? Is it your identity? Has it taken away your ability to function? What's the story you're telling yourself? Now, I tell them, don't make any judgments about that story. It's not good or bad or right or wrong. It just is. Having that awareness of, oh, I'm having these thoughts, I'm telling this story about this experience, helps people realize that then translates into an emotional and physical reaction. If you're telling a story about your pain that is increasing the perception of threat that pain presents in your life, you're going to feel stressed. What does that do to you physiologically? You've got stress hormones, muscle tension, all of those things that happen down the line. So it's really that awareness of what are the thoughts. I think the other piece that's just really simple that anybody can do is practicing exercises that help you turn off that alarm system. Breathing exercises are a great way to do that. I always teach the 4-7-8 breathing exercise, which really is designed to slow down your heart rate if you're in a moment of anxiety. So just those kind of little tips and tricks that you can do throughout the day, I think are really helpful for all of us, not just those dealing with pain. There's so many more that I could include: distraction, visualization, even things like topical treatments, and acceptance of the reality of the situation. But that's kind of the 30,000-foot overview.
Very helpful.
Wow, yeah, and this has been really fantastic. I mean, I think the mind-body connection is something that I think everyone talks about, but to hear you describe it so eloquently and how it relates to athletic injuries and spinal problems is really just great. And we're privileged to be able to work with someone like you. So thank you.
Thank you so much.
And thanks so much for joining us today. This is such a wonderful conversation, and I know we've been talking in the past, right? There's so many tools in your toolkit out there. If there's a lot of interest, we'll go live someday and see if we can answer some questions that people may have along the way. And I think it'd be just fun to engage in that conversation with people. But yeah, thanks, Dr. Kelly, for joining us today.
Thank you. I'd love to do that. Thank you so much. This has been fun.
All right. Well, until next time, be sure to like and subscribe and follow us on Instagram. Until next time, we'll see you guys later. Okay. Bye.
Everyone.